High blood pressure, the silent killer that leads to stroke. Every 36 seconds, someone in America dies from cardiovascular disease, and lurking behind many of these deaths is a condition so stealthy that nearly half of those who have it do not even know it exists. High blood pressure, medically known as hypertension, has earned its notorious nickname, the silent killer. Not through dramatic symptoms or sudden onset, but through its insidious ability to damage the body's most vital systems while remaining virtually undetectable. Like a master criminal operating in the shadows, hypertension methodically weakens blood vessels, strains the heart, and sets the stage for devastating strokes, all while its victims go about their daily lives completely unaware of the danger mounting within their circulatory system. Understanding the enemy within. To comprehend how high blood pressure becomes such a formidable threat, we must first understand what blood pressure actually represents. Blood pressure is the force exerted by circulating blood against the walls of blood vessels, particularly arteries, as the heart pumps blood throughout the body. This pressure is essential for life. Without it, oxygen and nutrients could not reach our organs and tissues. The measurement of blood pressure involves two numbers: systolic pressure. The higher number represents the pressure when the heart beats and pushes blood through the arteries, while diastolic pressure, the lower number, indicates the pressure when the heart rests between beats. A normal blood pressure reading typically falls below 120/80 millimeters of mercury. When blood pressure consistently reads 130/80 millimeters of mercury, or higher, medical professionals diagnose hypertension. This seemingly simple elevation in numbers triggers a cascade of physiological changes that can prove fatal over time. The American Heart Association has established clear categories for blood pressure readings. Normal blood pressure measures less than 120/80 millimeters of mercury. Elevated blood pressure shows systolic between 120 and 129, with diastolic less than 80. Stage 1 hypertension presents systolic between 130 and 139, or diastolic between 80 and 89. Stage 2 hypertension demonstrates systolic of 140/90 or higher. Hypertensive crisis occurs when readings exceed 180/120, requiring immediate medical attention. The anatomy of silent destruction. The reason hypertension earns its silent killer reputation lies in its ability to cause extensive damage without producing noticeable symptoms. Unlike other serious conditions that announce themselves through pain, discomfort, or visible changes, high blood pressure operates like a slow poison, gradually compromising the integrity of blood vessels throughout the body. When blood consistently flows through arteries at elevated pressure, the vessel walls must work harder to accommodate this force. Over time, this increased workload causes the arterial walls to thicken and lose their natural elasticity. The once flexible and smooth inner lining of arteries becomes rough and rigid, creating an environment where cholesterol, calcium, and other substances can easily accumulate, forming dangerous plaques. This process, known as atherosclerosis, transforms healthy arteries into narrow, hardened tubes that struggle to deliver adequate blood flow to vital organs. The heart, brain, kidneys, and eyes all depend on a steady supply of oxygen-rich blood, and when hypertension compromises this supply, these organs begin to suffer in ways that may not become apparent until significant damage has already occurred. The cardiovascular system responds to chronic high blood pressure by attempting to compensate for the increased workload. The heart muscle enlarges as it works harder to pump blood through resistant arteries, a condition called left ventricular hypertrophy. While this adaptation may initially help maintain cardiac output, the enlarged heart eventually becomes less efficient and more prone to rhythm disturbances, heart failure, and sudden cardiac death. Meanwhile, the kidneys, which play a crucial role in regulating blood pressure through fluid balance and hormone production, begin to show signs of strain. The delicate filtering units within the kidneys, called glomeruli, become damaged by the constant high pressure, leading to decreased kidney function and the potential for chronic kidney disease. The stroke connection. Among all the devastating consequences of untreated hypertension, stroke represents one of the most feared and life-altering outcomes. The relationship between high blood pressure and stroke is both direct and profound, with hypertension serving as the single most important modifiable risk factor for cerebrovascular disease. Strokes occur when blood flow to a portion of the brain is interrupted or severely reduced, depriving brain tissue of essential oxygen and nutrients. Within minutes of this disruption, brain cells begin to die, potentially causing permanent damage to cognitive function, motor skills, speech, and other vital capabilities. The two main types of stroke, ischemic and hemorrhagic, are both closely linked to hypertension, though through different mechanisms. Ischemic strokes, which account for approximately 85% of all strokes, result from blocked blood flow to the brain. High blood pressure contributes to ischemic stroke by accelerating the development of atherosclerosis in the arteries supplying the brain. As plaques build up in these vessels, they can either grow large enough to significantly narrow the artery or become unstable and rupture, triggering the formation of blood clots that completely block blood flow. The carotid arteries, which run along either side of the neck and supply much of the brain's blood, are particularly vulnerable to atherosclerotic changes caused by hypertension. When these major vessels become narrowed or blocked, the resulting stroke can cause extensive brain damage affecting movement, speech, vision, and cognitive function. Hemorrhagic strokes, while less common, are often more severe and are even more directly related to high blood pressure. These strokes occur when a blood vessel in the brain ruptures, allowing blood to leak into the surrounding brain tissue. The constant elevated pressure within blood vessels weakens their walls over time, making them more susceptible to rupture, especially in areas where the vessels are naturally smaller and more fragile. Intracerebral hemorrhage, bleeding directly into brain tissue, is strongly associated with long-standing hypertension. The small penetrating arteries deep within the brain are particularly vulnerable to pressure-related damage, and when these vessels rupture, the resulting bleeding can destroy surrounding brain tissue and create dangerous increases in intracranial pressure. Subarachnoid hemorrhage, bleeding into the space surrounding the brain, can also be linked to hypertension, particularly when it involves the rupture of weakened aneurysms. High blood pressure increases the stress on arterial walls and can contribute to the formation and eventual rupture of these balloon-like bulges in blood vessels. The statistics tell a grim story. The numbers surrounding hypertension and stroke paint a sobering picture of this public health crisis. According to the American Heart Association, approximately 116 million American adults have high blood pressure, representing nearly half of the adult population. Even more alarming, only about 1 in 4 adults with hypertension have their condition under control. The global impact is equally staggering. The World Health Organization estimates that hypertension affects more than 1 billion people worldwide and contributes to over 10 million deaths annually. Among these deaths, stroke represents a significant portion, with high blood pressure being responsible for roughly 70% of all strokes. The economic burden of hypertension and its complications is enormous. In the United States alone, high blood pressure costs the healthcare system over $50 billion annually in direct medical expenses, lost productivity, and premature death. Stroke, as one of the primary consequences of uncontrolled hypertension, adds another $40 billion in healthcare costs each year. Perhaps most troubling is the fact that many people with hypertension remain undiagnosed. The Centers for Disease Control and Prevention estimates that nearly 45% of adults with uncontrolled high blood pressure are not receiving treatment, often because they are unaware they have the condition. This silent epidemic continues to grow as lifestyle factors that contribute to hypertension become increasingly prevalent in modern society. Risk factors and contributing elements. Understanding the factors that contribute to high blood pressure is crucial for both prevention and management. While some risk factors cannot be changed, many others are within our control, offering hope for reducing the burden of this silent killer. Non-modifiable risk factors include age with blood pressure naturally tending to increase as we get older due to changes in arterial elasticity and kidney function. Gender also plays a role, with men generally at higher risk before age 55, while women face increased risk after menopause when protective hormonal influences decline. Race and ethnicity significantly impact hypertension risk, with African Americans experiencing higher rates and more severe complications than other groups. Family history represents another important non-modifiable factor. Individuals with parents or siblings who have hypertension face significantly increased risk of developing the condition themselves, suggesting important genetic components that influence blood pressure regulation. However, lifestyle factors represent the most significant contributors to hypertension development and offer the greatest opportunities for prevention and control. Diet plays a central role, with excessive sodium intake being one of the most well-established dietary risk factors. The typical American diet contains far more sodium than recommended, primarily from processed and restaurant foods rather than table salt. A diet high in saturated fats, trans fats, and cholesterol contributes to both hypertension and the atherosclerotic changes that increase stroke risk. Conversely, diets rich in fruits, vegetables, whole grains, and lean proteins have been shown to help maintain healthy blood pressure levels. Physical inactivity represents another major modifiable risk factor. Regular physical activity helps strengthen the heart, improve circulation, and maintain healthy weight, all of which contribute to normal blood pressure. Sedentary lifestyle, increasingly common in our technology-driven society, promotes not only hypertension, but also obesity, diabetes, and other cardiovascular risk factors. Obesity significantly increases hypertension risk through multiple mechanisms. Excess body weight requires the heart to pump harder to supply blood to additional tissue, increasing the workload on the cardiovascular system. Obesity also promotes insulin resistance, increases inflammation, and can disrupt normal hormonal regulation of blood pressure. Smoking and tobacco use cause immediate increases in blood pressure and heart rate, while promoting long-term damage to blood vessels. The chemicals in tobacco smoke damage the inner lining of arteries, making them more susceptible to atherosclerotic changes and blood clot formation. Excessive alcohol consumption can raise blood pressure both acutely and chronically. While moderate alcohol intake may have some cardiovascular benefits, heavy drinking consistently elevates blood pressure and increases stroke risk through multiple pathways. Chronic stress, whether from work relationships or other life circumstances, can contribute to hypertension through both direct physiological effects and indirect behavioral changes. Stress hormones like cortisol and adrenaline cause temporary blood pressure increases, and chronic exposure to these hormones may lead to persistent elevation. Sleep disorders, particularly sleep apnea, have emerged as important contributors to hypertension. The repeated episodes of oxygen deprivation and sleep disruption characteristic of sleep apnea trigger hormonal and neurological changes that promote high blood pressure. The body under siege. When hypertension takes hold, it initiates a complex series of physiological changes that extend far beyond simple pressure elevation. The cardiovascular system becomes a battlefield where normal regulatory mechanisms are overwhelmed, and compensatory responses ultimately become part of the problem. The heart bears much of the initial burden of sustained high blood pressure. As the left ventricle works against increased arterial resistance, the heart muscle begins to thicken and enlarge. This left ventricular hypertrophy initially helps maintain cardiac output, but over time the enlarged muscle becomes stiffer and less efficient at filling with blood between beats. The electrical conduction system of the heart also suffers under the strain of hypertension. The enlarged and stressed heart muscle becomes more prone to rhythm disturbances, including atrial fibrillation, a condition that significantly increases stroke risk by promoting blood clot formation within the heart chambers. Blood vessels throughout the body undergo fundamental structural changes in response to chronic pressure elevation. The smooth muscle cells within arterial walls multiply and enlarge, causing the vessel walls to thicken and the internal diameter to narrow. This remodeling process, while initially protective, ultimately reduces the ability of arteries to dilate and accommodate changes in blood flow. The endothelium. The thin layer of cells lining the inside of blood vessels becomes dysfunctional under the constant stress of high pressure. These cells normally produce substances that help regulate blood flow, prevent clot formation, and maintains vessel health. When damaged by hypertension, the endothelium loses these protective functions and may actually contribute to vessel constriction and clot formation. Kidney function becomes progressively impaired as hypertension damages the delicate filtering structures within these vital organs. The glomeruli, tiny clusters of blood vessels where filtration occurs, become scarred and less efficient. As kidney function declines, the body's ability to regulate fluid balance and blood pressure becomes compromised, creating a vicious cycle where kidney damage leads to worsening hypertension. The renin-angiotensin-aldosterone system, a complex hormonal pathway crucial for blood pressure regulation, becomes dysregulated in chronic hypertension. This system normally helps maintain appropriate blood pressure and fluid balance, but in hypertensive individuals, it may become overactive, contributing to persistent pressure elevation and promoting further cardiovascular damage. Early warning signs and symptoms. The challenge of hypertension lies not only in its potential for causing devastating complications, but also in its ability to progress silently for years without producing obvious symptoms. Most people with high blood pressure feel completely normal, which is precisely what makes this condition so dangerous. However, some individuals may experience subtle signs that could indicate elevated blood pressure, though these symptoms are often attributed to other causes or dismissed as normal responses to stress or fatigue. Headaches, particularly those occurring in the morning or at the back of the head, may sometimes be associated with high blood pressure, though this connection is not consistent or reliable. Dizziness or lightheadedness, especially when standing up quickly, might indicate blood pressure irregularities, though these symptoms can have many other causes. Some people report feeling unusually fatigued or experiencing difficulty concentrating, which could be related to the cardiovascular strain imposed by hypertension. Chest pain or discomfort may occur in individuals with hypertension, particularly if the condition has led to coronary artery disease or left ventricular hypertrophy. Shortness of breath, especially during physical activity, might indicate that the heart is struggling to meet the body's demands under the increased workload imposed by high blood pressure. Vision changes, including blurred vision or seeing spots, can be signs of hypertensive retinopathy, a condition where high blood pressure damages the blood vessels in the eyes. This complication can be an early indicator of more widespread vascular damage throughout the body. Nosebleeds, while often attributed to dry air or minor trauma, may sometimes be more frequent in individuals with significantly elevated blood pressure, though this is not a reliable diagnostic indicator. It is crucial to understand that the absence of symptoms does not mean the absence of danger. Many people with severe hypertension feel perfectly fine until they experience a heart attack, stroke, or other serious complication. This is why regular blood pressure monitoring is essential for everyone, particularly those with risk factors for cardiovascular disease. The path to stroke. The journey from elevated blood pressure to stroke is neither immediate nor inevitable, but it follows predictable pathways that underscore the importance of early detection and intervention. Understanding these pathways can help individuals and healthcare providers recognize opportunities for prevention and take appropriate action. The atherosclerotic pathway represents the most common route by which hypertension leads to stroke. Years of elevated pressure gradually damage the inner lining of arteries, creating rough surfaces where cholesterol and other substances can accumulate. These atherosclerotic plaques grow slowly, progressively, narrowing the vessel lumen and reducing blood flow to vital organs, including the brain. The carotid arteries, which carry blood from the heart to the brain, are particularly vulnerable to atherosclerotic changes. As these vessels narrow, they may produce warning signs such as transient ischemic attacks, brief episodes of stroke, like symptoms that resolve within 24 hours. These mini-strokes serve as important warnings of impending danger and should prompt immediate medical evaluation. When atherosclerotic plaques become unstable, they can rupture, exposing their contents to the bloodstream and triggering the formation of blood clots. These clots can completely block blood flow to portions of the brain, causing ischemic stroke. The size and location of the affected brain area determine the severity and type of stroke symptoms. The hemorrhagic pathway involves the weakening and eventual rupture of blood vessels within or around the brain. Chronic hypertension causes fundamental changes in arterial structure, making vessel walls thinner and more prone to rupture. Small penetrating arteries deep within the brain are particularly susceptible to pressure-related damage. When these weakened vessels rupture, blood leaks into brain tissue, destroying neurons and creating dangerous increases in intracranial pressure. The resulting intracerebral hemorrhage can be rapidly fatal or cause severe permanent disability, depending on the location and extent of bleeding. Hypertension also contributes to the formation and growth of cerebral aneurysms, balloon-like bulges in arterial walls, that can rupture and cause subarachnoid hemorrhage. The constant elevated pressure within blood vessels increases the stress on these weak points, making rupture more likely. The embolic pathway involves the formation of blood clots in other parts of the cardiovascular system that subsequently travel to the brain and cause stroke. Hypertension promotes clot formation by damaging vessel walls, altering blood flow patterns, and contributing to conditions like atrial fibrillation that increase embolic risk. Prevention strategies. The encouraging news about hypertension is that despite its serious consequences, it is largely preventable and highly treatable. Comprehensive prevention strategies focus on addressing modifiable risk factors and implementing lifestyle changes that promote cardiovascular health. Dietary modifications represent one of the most powerful tools for preventing and controlling hypertension. The dietary approaches to stop hypertension. Eating plan, commonly known as the DASH diet, has been extensively studied and proven effective for reducing blood pressure. This approach emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products, while limiting sodium-saturated fats and processed foods. Sodium reduction is particularly important, with most health organizations recommending no more than 2,300 milligrams of sodium daily, and ideally less than 1,500 milligrams for individuals with hypertension or at high risk. This requires careful attention to food labels and cooking methods, as most dietary sodium comes from processed and restaurant foods rather than table salt. Increasing potassium intake through foods like bananas, oranges, spinach, and sweet potatoes can help counteract the effects of sodium and support healthy blood pressure levels. Adequate calcium and magnesium intake obtained through dairy products, leafy greens, nuts, and seeds also contribute to blood pressure control. Regular physical activity provides multiple benefits for blood pressure management. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic activity, or 75 minutes of vigorous activity weekly, along with muscle-strengthening exercises twice per week. Even modest increases in physical activity can produce meaningful reductions in blood pressure. Weight management is crucial for individuals who are overweight or obese. Even modest weight loss of 5 to 10 pounds can produce significant improvements in blood pressure. Sustainable weight loss strategies focus on creating moderate caloric deficits through a combination of dietary changes and increased physical activity. Stress management techniques, including meditation, deep breathing exercises, yoga, and regular relaxation practices, can help reduce both acute blood pressure spikes and chronic elevation. Finding healthy ways to cope with life stressors is an important component of comprehensive hypertension prevention. Limiting alcohol consumption to moderate levels defined as no more than 2 drinks daily for men and 1 drink daily for women can help maintain healthy blood pressure. Heavy drinking consistently raises blood pressure and should be avoided. Smoking cessation is essential for cardiovascular health and blood pressure control. The immediate effects of smoking on blood pressure and heart rate, combined with the long-term damage to blood vessels, make tobacco use one of the most important modifiable risk factors to address. Adequate sleep, typically 7 to 9 hours nightly for most adults, supports healthy blood pressure regulation. Sleep disorders, particularly sleep apnea, should be diagnosed and treated promptly to prevent their contribution to hypertension development. Treatment approaches, when lifestyle modifications alone are insufficient to control blood pressure, medical treatment becomes necessary to prevent serious complications, including stroke. Modern antihypertensive therapy offers multiple effective options that can be tailored to individual patient needs and characteristics. The goal of antihypertensive treatment is to reduce blood pressure to target levels while minimizing side effects and preserving quality of life. For most adults, the target blood pressure is less than 130/80 millimeters of mercury, though individual targets may vary based on age, comorbid conditions, and cardiovascular risk factors. ACE inhibitors represent one of the most commonly prescribed classes of blood pressure medications. These drugs work by blocking the conversion of angiotensin E to angiotensin II, a powerful vasoconstrictor, thereby reducing blood vessel constriction and decreasing blood pressure. ACE inhibitors also provide protective effects for the heart and kidneys beyond their blood pressure-lowering properties. Angiotensin receptor blockers offer similar benefits to ACE inhibitors, but work by blocking the action of angiotensin II at its receptor sites rather than preventing its formation. These medications are often prescribed for patients who cannot tolerate ACE inhibitors due to side effects like chronic cough. Calcium channel blockers prevent calcium from entering smooth muscle cells in blood vessel walls, causing relaxation and vasodilation. These medications are particularly effective for certain populations and can be especially useful in individuals with both hypertension and certain types of heart rhythm disorders. Diuretics, often called water pills, help reduce blood pressure by promoting the elimination of excess sodium and fluid from the body. Different types of diuretics work at various sites within the kidney and may be combined with other antihypertensive medications for optimal effect. Beta blockers reduce blood pressure by blocking the effects of adrenaline and other stress hormones on the heart and blood vessels. These medications slow heart rate and reduce the force of heart contractions, thereby decreasing blood pressure and reducing the heart's workload. Combination therapy using multiple medications with different mechanisms of action is often necessary to achieve target blood pressure levels. Fixed-dose combinations that include 2 or more medications in a single pill can improve adherence and simplify treatment regimens. Regular monitoring and medication adjustments are essential components of successful hypertension management. Blood pressure responses to medications can vary significantly between individuals, and finding the optimal regimen may require patience and multiple adjustments. So the role of regular monitoring. Given the silent nature of hypertension, regular blood pressure monitoring is essential for early detection and ongoing management. Understanding proper monitoring techniques and interpreting results correctly can be life-saving. Home blood pressure monitoring has become increasingly important as a complement to office-based measurements. Automated home monitors provide convenient and accurate readings when used properly, allowing individuals to track their blood pressure trends over time and detect variations that might be missed during occasional office visits. Proper technique is crucial for accurate blood pressure measurement. The cuff should be appropriately sized for the individual's arm, positioned at heart level, with the person seated comfortably with feet flat on the floor. Multiple readings taken at different times provide more reliable information than single measurements. White coat hypertension, where blood pressure readings are elevated in medical settings but normal at home, affects a significant portion of the population. Conversely, masked hypertension involves normal office readings but elevated home measurements. Both conditions highlight the importance of comprehensive monitoring strategies. Ambulatory blood pressure monitoring, where individuals wear a device that takes readings throughout a 24-hour period, provides the most comprehensive assessment of blood pressure patterns. This technique can reveal nocturnal hypertension, blood pressure, variability, and other patterns that influence cardiovascular risk. The frequency of monitoring depends on individual risk factors and current blood pressure control. People with normal blood pressure should have it checked at least every 2 years, while those with elevated readings or multiple risk factors may need more frequent monitoring. Keeping detailed records of blood pressure readings, along with information about medications, diet, exercise, and other relevant factors, helps healthcare providers make informed treatment decisions and allows individuals to track their progress over time. Living with hypertension. A diagnosis of hypertension need not be a sentence to inevitable complications. With proper management, individuals with high blood pressure can live full active lives while significantly reducing their risk of stroke and other cardiovascular events. Medication adherence represents one of the most critical factors in successful hypertension management. Taking prescribed medications consistently, even when feeling well, is essential for maintaining blood pressure control and preventing complications. Establishing routines using pill organizers and setting reminders can help improve adherence. Regular follow-up with healthcare providers allows for monitoring of blood pressure control, assessment of medication, effectiveness, and early detection of any complications. These visits also provide opportunities to discuss concerns, adjust treatment plans, and receive ongoing education about hypertension management. Lifestyle modifications remain important even when taking medications. The combination of medication and healthy lifestyle choices often provides better blood pressure control than either approach alone, while potentially allowing for lower medication doses and fewer side effects. Self-advocacy plays a crucial role in hypertension management. Understanding the condition, asking questions during medical appointments, and actively participating in treatment decisions can improve outcomes and quality of life. Building a support network of family members, friends, and healthcare providers can provide encouragement and assistance with lifestyle changes and medication management. Support groups, either in person or online, can connect individuals with others facing similar challenges. Stress management becomes particularly important for people with hypertension, as acute stress can cause temporary blood pressure spikes, while chronic stress may contribute to long-term elevation. Developing healthy coping strategies and seeking professional help when needed can improve both blood pressure control and overall well-being. The future of hypertension management. Advances in medical technology and understanding of hypertension continue to improve prevention and treatment options. Emerging therapies and approaches offer hope for better outcomes and more personalized care. Precision medicine approaches that consider individual genetic factors, biomarkers, and other personal characteristics are beginning to inform hypertension treatment decisions. This personalized approach may lead to more effective medication selection and dosing strategies. Novel drug delivery systems, including long-acting formulations and combination therapies, aim to improve medication adherence and reduce the burden of complex treatment regimens. Some experimental approaches involve implantable devices that can provide continuous medication delivery. Digital health technologies, including smartphone apps, wearable devices, and telemedicine platforms, are transforming hypertension, monitoring, and management. These tools can provide real-time feedback, improve patient engagement, and enhance communication between patients and healthcare providers. Research into the underlying mechanisms of hypertension continues to reveal new therapeutic targets and potential interventions. Understanding the complex interplay between genetics, environment, and lifestyle factors may lead to more effective prevention strategies. Public health initiatives aimed at reducing population-wide blood pressure levels through policy changes, environmental modifications, and community-based interventions show promise for addressing hypertension at a societal level. Conclusion. High blood pressure truly deserves its reputation as a silent killer, operating stealthily to damage blood vessels, strain the heart, and set the stage for devastating strokes. The statistics are sobering, with millions of people worldwide living with undiagnosed hypertension and facing increased risk of life-threatening complications. However, this grim picture is balanced by genuine cause for hope. Hypertension is largely preventable through lifestyle modifications, and when it does develop, highly effective treatments are available to control blood pressure and dramatically reduce stroke risk. The key lies in awareness, early detection, and consistent management. Understanding the connection between high blood pressure and stroke empowers individuals to take proactive steps to protect their health. Regular blood pressure, monitoring healthy lifestyle choices, medication adherence when necessary, and ongoing medical care can transform hypertension from a silent killer into a manageable condition. The fight against high blood pressure and its consequences requires both individual commitment and societal support. Healthcare providers, public health officials, and communities must work together to promote awareness, improve access to care, and create environments that support healthy choices. For the millions of people currently living with hypertension, the message is clear. This condition is serious, but not hopeless. With proper management, the silent killer can be silenced, and the risk of stroke can be dramatically reduced. The tools for victory in this battle are available today. What remains is the commitment to use them consistently and effectively. The journey from hypertension to stroke is not inevitable, but preventing it requires vigilance, knowledge, and action. By understanding the enemy within and taking appropriate steps to address it, we can protect ourselves and our loved ones from becoming statistics in this ongoing public health crisis. The silent killer may be stealthy, but it is not unstoppable when faced with informed, determined, and consistent opposition.